Dr. Warwart, one of the physicians here at Pinnacle Fertility in Columbus, Ohio, and I wanted to take you behind the scenes for a hysterosalpingogram or an HSG. So here's the room where we do our HSGs. This is the X-ray machine. It's called a C-arm, and it basically allows us to watch live as we fill the uterus with dye and then hopefully see us spill out the tubes. So here's what the room looks like. Here's the bed where the patient would lay on, and then if you come over this way, we have the instruments. So the test involves placing a speculum so that I can see the cervix, and then cleaning off the cervix with little cotton swabs, just with a little bit of soap on them. After we clean off the cervix, then we use this little catheter that has a little balloon at the end, so it's called a balloon catheter. And basically the little skinny part that you can see in here, this little blue line, is what's actually being threaded through the cervix. And then we blow up a little tiny balloon, like the size of a small marble, and that allows the catheter to stay in place in the uterus. And then we push dye, contrast dye, right here, which just looks like clear fluid, through the balloon, and then we're watching under X-ray to see the dye fill the uterus so we can see the shape of the cavity, and then hopefully we're seeing it fill and spill out both the tubes. Okay, so the benefit of this test is that we're seeing everything live and you can get the results in real time, which is really beneficial. The crampy part about the test is when we're filling the uterus with dye, because the uterus doesn't like to be filled with anything, so it will cramp like period cramps to try and push that dye out. But that part only lasts for about 30-45 seconds at most. And so typically the test is very tolerable. We'll tell you to eat breakfast and take Motrin or a form of pain medication about an hour before the exam. After the exam, you can expect a little bit of cramping and some spotting or some of that dye kind of leaking out, so we'll have you wear a pad afterwards. But mostly no restrictions. You can go back to work afterwards and have a normal day. Okay, so you'll also notice that I'm wearing, and everyone in the room except the patient will be wearing these, what we call lead aprons. And this is basically because there is X-ray involved and radiation exposure. Because we're doing these repetitively, we wear lead aprons to reduce that radiation exposure. We don't have you as the patient wearing lead because that would affect our ability to see the results. And also it's very quick exposure into radiation, typically less than a minute, and not repetitive. So hopefully this was helpful in explaining a little bit of, again, behind the scenes for an HSG. This test is most useful for determining tubal patency, or if the tubes are open and look normal. It can also give us a little bit of an idea of what the uterine cavity looks like as well. If you have any questions, please reach out to us, and thanks.